Can dupilumab provide sustained, clinically meaningful responses in adults with moderate to severe atopic dermatitis? Hello, I'm Associate Professor Dr Foley. On behalf of my co-authors, I would like to present findings showing the multidimensional benefits of dupilumab over 1 year, using a holistic approach to measure atopic dermatitis signs, symptoms, and quality of life. The long-term assessment of atopic dermatitis needs to be multidimensional, including domains of signs, symptoms, and quality of life. But no single tool used in clinical trials is capable of assessing all aspects of atopic dermatitis. In the Liberty ad CHRONOS randomized, placebo-controlled, double-blinded 1-year phase 3 trial, 740 adult patients with moderate to severe atopic dermatitis, or AD, who had inadequate response to topical treatment were randomized 3:1:3 to receive 300 milligrams of dupilumab every week, or 300 milligrams of dupilumab every 2 weeks, or placebo, with concomitant medium potency topical corticosteroids, or TCS. In this analysis, only patients treated with dupilumab every 2 weeks, the approved dose in AD, or placebo were included. We defined 2 composite endpoints to evaluate improvement in atopic dermatitis signs, symptoms, and quality of life. The first endpoint, representing minimal clinically meaningful improvement, was the achievement of EASI-50, a 50% reduction in the eczema area and severity index, or at least a 3-point improvement from baseline in peak pruritus numerical rating scores, or NRS, or at least a 4-point improvement from baseline in dermatology life quality index, or DLQI. The second endpoint, representing no or mild disease activity, was the achievement of EASI less than or equal to 7, or peak pruritus NRS score of less than or equal to 4, or DLQI score of less than or equal to 5. At 4 months, 84% of dupilumab plus topical corticosteroid treated patients achieved a clinically meaningful improvement in at least one AD domain, versus 53% of patients treated with placebo plus TCS. 60% in the dupilumab arm achieved clinically meaningful improvements in all 3 domains, versus only 19% in the control arm, that is, those treated with placebo plus TCS. As early as the first dose, the majority of dupilumab-treated patients achieved no or mild disease activity in at least one AD domain. The proportion increased to 80% at 6 months in the dupilumab arm versus 40% in the control arm, and these were sustained at 1 year. At 6 months, 44% of dupilumab-treated patients achieved no or mild disease in all 3 AD domains, versus 10% in the TCS-only treated patients, again sustained through 1 year. Most patients treated with dupilumab plus TCS achieved a satisfactory multidimensional treatment response after 4 months of treatment. 64% achieved no or mild disease activity and at least one AD domain after the first dose. Importantly, for a chronic disease, this response was sustained over 1 year of treatment. Dupilumab was well tolerated, and the safety profile was consistent with the known dupilumab safety profile.